Slide 1. Hi, I'm Cheryl Robertson. My presentation is titled Social Support Affects Postpartum Depression. Slide 2. My review is on my PICO question, which is, in postpartum women, how does having social support compared to not having social support affect postpartum depression, PPD? Postpartum depression is a form of severe depression after giving birth that interferes with daily functioning and requires treatment. It can occur a few days, weeks, or even months after childbirth. A woman with postpartum depression may have feelings of sadness, despair, anxiety, and irritability to a severe degree. Treatment may involve counseling and/or medication. Slide 3. Significance. Postpartum depression, PPD, can rob mothers of precious time with their newborns and their families due to often uncontrollable emotions and thoughts, and frequently even their actions. PPD occurs in up to 1/5 of women in the United States and is the most common complication associated with pregnancy and childbirth. Social support can offer an outlet for the expression of thoughts and emotions for both primoparous and multiparous women, which can be beneficial for the mothers, their babies, and the entire family. The research indicates that social support is a significant factor in the occurrence of, longevity in, and severity experienced with PPD. Social support is a major buffer and has a positive influence on a woman's experience of PPD, childbirth, and pregnancy. This problem has significance for advanced practice nursing because advanced practice nurses, APNs, need to recognize PPD and to educate their clientele regarding PPD, including the range of emotions that may be experienced and methods of seeking help such as social support. Knowledge gathered on this subject and accessible solutions will enhance the ability of APNs to provide optimal care for pregnant and postpartum patients, including helping to reduce the stigma associated with PPD. Slide 4. Study review. 5 primary studies were reviewed, all of which were qualitative, none stating any specific conceptual framework or theoretical basis for the studies, and all 5 were described as content analysis. 2 stated thematic design, and 1 utilized qualitative content analysis, a case study, and a quantitative pilot study. 4 of the studies sampled postpartum mothers, and the 5th utilized online support group postings for analysis. All data analysis used dominant theme identification. Various methods were used for data collection. 2 audio recorded the interviews, while all stated use of some form of verbatim transcription and some form of concurrence on the analysis, not the least of which were to evaluate any inconsistencies. Only 1 study mentioned software, Atlas TI6, for data management. Slide 5. Literature synthesis. All of the studies concluded that social support, either in the form of emotional or informational, was critical to the thwarting, help in management, or reduction in PPD. My interpretive paper reviewed only a minute portion of the qualitative studies, and only 1 of the studies mentioned quantitative analysis, while there are numerous quantitative studies on or related to this subject. These studies' value to nursing practice includes the following recommendations: to provide information to postpartum women on PPD, its manifestations, treatments, and effects; helping women to improve skills to get help when needed; being cognizant of cultural considerations; encourage and support additional research; and helping make the necessary resources available for support. Assessing women through the various stages of transitioning to motherhood would provide benefit to both expectant or new mothers and their babies, and also their families. Providing information on PPD, teaching skills to get needed assistance, making support referrals with cultural consideration, and promoting additional research are all methods within the scope of the advanced practice nurse to help optimize the postpartum mother's experience of motherhood and help ensure the well-being of not only the mother, but also her baby. Slide 6, proposal. One intervention that would promote potential optimal outcomes for mother and baby would be the implementation of a support group with mentorship available for postpartum mothers. Healthcare environment. Although this might be available at the mother's obstetrician's office, a better environment would be the pediatrician's office, where the mother could be screened for signs and symptoms of depression and provided a mentor or offered a support group for help. The depression assessments could be made part of each visit to the office, with support offered and follow-up if the mother was reluctant to participate initially. One major challenge for the mother and her healthcare providers are recognition, acknowledgement, and understanding of postpartum depression. Postpartum depression is a major public health problem and a thief that steals motherhood. Reducing the stigma of PPD is the responsibility of healthcare providers privileged to care for mothers and their new babies, and this recognition will allow for greater social support for the women who hold not only their futures, but the futures of their new little ones in their hands. Slide 7, references. Thank you.